right now.
Yeah, and Homie said, don't forget to hit record if you're planning on using it again. Yeah, I might have to
where's that? Oh, the record. Okay, I gotcha.
Yeah.
Can you see me?
With the mirror, I got this. All right, I'll hang up now.
All right. Hey, Jen, can you hear me?
Which has become so routine in today's society. So he dedicates his time today to treating craniofacial pain, which includes TMD and headaches, as well as sleep breathing disorders such as snoring and sleep apnea. In his spare time, he enjoys time with his 2 children, Bryce and Reese, and his wife, Renee. So I will go ahead and send it on over to Dr. Robinson for this really exciting, our first patient info session.
Cool. Thank you so much, Jen. So just confirm here that you can see my presentation.
I can.
All right, awesome.
And Dr. Robinson, I did want to add, if anyone has any questions at any time, feel free to put them in the Q&A. I'll try to answer them as we go along in the chat, but if not, we'll certainly save those for the end. Dr. Robinson would be happy to answer any questions that you may have.
Cool, so I'm gonna get started. So yeah, thank you everybody for attending tonight's info night. Like Jen mentioned, it is our first official public info night. Typically we do these around the community, blood bank, at the hospital, at the library, you know, any the Hockessin Athletic Club, any place that allows us to kind of spread our mission and talk about, you know, the things that we readily enjoy doing in our practices on a daily basis. So I'm going to jump right into it. Tonight we are going to discuss a lot about sleep, a lot about TMJ, a lot about breathing, and overall finding the root cause of our patients' health problems. So tonight we're going to just touch on some very sort of high-level things that certainly need further discussion in order to understand them to the depth that they really need to be understood to. So if anybody has any more questions, please feel free to email me. And we can continue the conversation. If you want a copy of my slides, I would always be more than grateful to hand those out as well. So take a picture of this, write it down, email me anytime. As far as the Zoom webinar etiquette, I feel like everybody is sort of accustomed to these platforms at this point. I cannot see you, I cannot hear you, but if you do have any questions, just like Jen said, type it into the chat box and I'll be more than happy to answer any of these questions at the end of the presentation. So a little bit about myself. I am a born and raised Delawarean. I went to University of Delaware for my undergraduate studies. I went to the University of Maryland for my dental education. And I like to joke with people and say that after dental school is when my real education started. I was indoctrinated with a set of principles that allowed me to become a really, really good tooth mechanic. I felt very passionate about dentistry, as Jen said, and I was a CE junkie, and I was traveling around the country learning as much as I could about this great profession. Was having a wonderful time doing it. And then I ran into the airway and my life was changed. And I'll go into a little bit more about my why in just a few slides. But, you know, that's when I really took on making this, you know, my career and, you know, continuing to move myself out of the dental practice and, you know, create a center, a practice that focuses on people's pain and people's sleep issues and sort of a practice that's dedicated to optimal health and wellness through good breathing. So a couple of board certifications that I have is American Board of Dental Sleep Medicine, American Board of Craniofacial Dental Sleep Medicine, the American Board of Craniofacial Pain, and diplomate with oral facial myology. So I've completed a whole lot of continuing education hours in craniofacial pain and sleep medicine. So I'm going to touch on some topics tonight that hopefully you find interesting and can share with your friends, family, loved ones, and colleagues. So just a little bit more about me. This is my beautiful family. That's myself, my wife, Renee, who's my high school sweetheart, our 2 kids, Bryce and our daughter, Reese. Bryce is 5 years old. Reese is 3 years old. Here's some great pictures of us this summer on the beach. With COVID going on, we got a lot of time to spend together down at the beach house down in Lewis, Delaware. So my son's kind of getting ready to learn how to do some water skiing and hopefully some wakeboarding at some point, like his dad. So got him in the little trainer tube right there. And my daughter just being the ornery little devil that she is, and enjoying their time on the beach. So great summer. I like to tell people it's become my passion to help adults and children breathe better in order to optimize their health and wellness. So just a little bit about my practice before we get into tonight's topic. I'm very fortunate to be practicing in a beautiful center, a beautiful building. The building's only a year or two old. It's called the Center for Health and Wellness. Our practice is obviously called the Pain and Sleep Therapy Center. I'm very lucky to work with some really talented and compassionate providers that are a part of our team at the Pain and Sleep Therapy Center. So obviously it's myself. Next to me on the right, my right on the left is Dr. Joanna Green, and she is responsible for our pediatric tongue tie program. And she also is into orthodontics and early orthodontics and growth appliances. And so she deals with a lot of our pediatric population. To the left of Joanna is one of our myofunctional therapists, Lauren Reinhold. And to the right of me is our other myofunctional therapist, who's also a speech language pathologist and a lactation consultant. And her name is Leah. And then, of course, our team next to us over here on the right. And we have a really good group of small but growing good group of people who are really just dedicated. And I'm so lucky to get to come to work with these guys on a daily basis, because I can truly say that they are, committed to they have the same passion that I do, and they are committed to, doing what's best for our patients on a daily basis. And that's all I can ask, because with a good team behind you, the sky is the limit. So our practice is an airway-focused integrative center for health and wellness. That's what we like to call it. Our mission statement is we provide hope and we enhance the quality of life for adults and children by finding the source of the problem to help improve sleep, increase energy, alleviate pain, and promote proper growth and development. And so 100% of our time is actually spent treating airway-related disorders and craniofacial pain, which is what we're going to be talking about tonight. So some of the services that we provide here is we do everything related to the airway. We treat snoring, we treat upper airway resistance, we treat obstructive sleep apnea, we treat all temporomandibular joint dysfunctions and disorders, we treat primary headaches, we treat any undiagnosed pain of the head and neck, we treat oral restrictions, as I mentioned, the tongue and lip ties. We have the myofunctional therapy in our practice, 2 myofunctional therapists. And then, of course, we have dedicated the last year or so to developing our pediatric side of the practice, where we focus on growth and development and intervening as early as we possibly can to get kids' issues figured out. And as we like to say, we like to treat the smoke, before it becomes the fire. And so I like to say that all of these things have one thing in common, and they all are related to the way that people breathe. And so we're a very active practice. We have a lot of engagement and a lot of activity on our social media platforms. So if you're watching this, you might as well go ahead and give us a follow on our Facebook page, our Instagram feed, and our YouTube channel, which is where you can find a lot of my old lectures that I gave, especially during the COVID shutdown. And then, of course, you can find out more information about us using our website, www.painandsleepcenter.com. And of course, there's my email and the office number. So we really like to engage with the community. We really like to spread our knowledge and our passion on this stuff. So hopefully you learn a lot tonight. So I like to ask people when I lecture, whether it's in person or on Zoom, why are you here? And that to me is a very powerful question, because, we have choices in life, and everybody made the choice to log on tonight. So there's probably different reasons for many of you. And we'll get into kind of why I'm here tonight and why I do what I do. But first, I figured might as well try and relate to you guys. So maybe you heard about us in the community. Maybe you heard about, a friend of yours who struggles, and you're here for them. Maybe it's you who struggles. And maybe you just hear that this whole thing called snoring is actually not normal, and it's actually a problem. So I say, are you here because do you know someone who snores, and are you wondering how you can help out? And if that's the case, maybe you just turn to the easy solution, which is pillow tightly over the partner's face, and you hold until the snoring stops. So that's a pretty simple way to do it. But if you're interested in more than that, then you'll hopefully learn some more things about what snoring is and sort of the alarm that is tonight. Do you know someone who suffers from jaw pain or headaches and has not found permanent relief to that? So all too common today's day and age, we have patients who live with pain. We have patients who live with dysfunction. We have patients that take medications for these things. We have patients that, look for short-term Band-Aid fixes just because, they haven't found anybody who can actually get to the root cause of their problem. So we're really good at treating these patients. I'd say the majority of my patients walk into my office with jaw pain, and we get a lot of dental practice referrals for people, dentists who send their patients to me who suffer from TMD. So my why is in 2015, I was blessed to welcome my son into the world. So this is my first child, Bryce, and here he is in his one of his many stints at the AI DuPont in the Moores Clinic, a local hospital here, where I'm from. And he had some breathing issues, and he is there. You can see him with supplemented with oxygen. You can see his lips hanging open, and we'll talk about more about that. And so my son dealt with a lot of breathing issues when he was born up until we got him the therapy that he needed. And, if that wasn't enough, a couple years later, my daughter was in the same exact place, and she found herself in AI for some breathing issues. And so this is really when it got serious for me. I was very interested in all of this stuff before these guys were born. And I started to dabble, in helping people with sleep and learning more about, TMJ and the dysfunctions that's caused. But when these guys were born, really just set me on a rampage. And this is when I got all my boarding credentials. This is when I kind of, put aside everything. I made sacrifices, in my professional life and in my personal life. And I just couldn't not know about breathing anymore. I had to kind of go and figure this stuff out. And, since that happened, I've really pretty much dedicated my entire continuing education to being able to learn about this stuff. So here's just a couple of videos to show you a kid who can't breathe properly and the effort that's being made just to get oxygen into his body. My daughter. So there's my son on a typical Saturday morning when he was about a year and a half old, maybe 2 years old at that point, nebulizer, watching some cartoons. And that just broke my heart. And so, I've learned how to treat adults, and, we kind of have started to treat a lot more kids these days, and we'll go into that tonight. But, these are the guys that kind of are my driving force. This is what gets me up in the morning to kind of do what I do. So to kind of turn to us and as a population, I like to show this graph because it's very concerning. So the amount of money that we spend in this country is just, it's astounding. And so when you compare the United States and the amount of healthcare spending that we have in comparison to the other industrialized nations, I mean, there's no comparison. I mean, we are head and shoulders above the rest as far as the spending. And, we're sick as a country. I mean, there's more and more chronic disease. There's more and more people that use healthcare. And we'll get into that. I don't even call it healthcare anymore. I call it sick care. But as a country, we're sick. And the problem is we're not really getting any better. The projected rates of health are declining. And as sad as that sounds, because of how industrialized modern medicine has become and how, we know so much more today than we know before, we're just not making good decisions, and we're not really focusing on the pillars of health, which we're going to talk about. So, I invite everybody when they hear me speak is, I want to bring you into an evolution and a revolution. So it's going to take a revolution to change the face of healthcare. And so healthcare today is not really healthcare. It's sick care. And so the sick people get help, and the people that are not sick yet have to wait until they get sick before they get health. And so there's a lot of providers who are sort of challenging that modality and challenging that current system that's in place. And so a lot of us, like myself and the people that I refer to, we're into lifestyle medicine. We're into longevity of health. We're into prevention. We're into the pursuit of optimal health and wellness. We're not into the average. We're not into the mean. We're into looking at the people who are thriving. And those are the people that we want to study. We want to learn how to optimize our health. Now more than ever with COVID, so rampant. Now more than ever, now's the time to look into these, core pillars of health. And so, when we talk about the core pillars of health, we talk about, shucks, the slide did not come over correctly. So when we talk about the core pillars of health, and I'm sorry, there we go. So 3 eras of medicine. So that first era of medicine was, us as human beings just trying to fight off infectious diseases. These infectious diseases would kind of ravage populations. And that first era of medicine is when we learned how to get vaccines and we learned how to get antibiotics to be able to treat this stuff. And so that was a big breakthrough because we could prevent, massive amounts of death and morbidity and mortality among populations. The second era of medicine is kind of where we're at right now, and that's the reactive model. And we've gotten so good at when we find out that there's a problem and we find out that someone's sick, we've got technology, we've got so many good drugs out today that can just try and save someone's life. And so, these life-saving procedures are great. I mean, it's the evolution of medicine, but my colleagues and I, we like to think that we're heading into the third era of medicine, and that third era of medicine is a root cause model. And we ask why until we can't ask why anymore. And we ask why and why and why and why. And we want to get to the root of some of these issues. So the root causes of diseases, it takes time. You have to peel back the layers. You have to go look at the things that matter. You have to look at sleep. You have to look at nutrition. You have to look at movement of the body. And these are the pillars. And so we find that all these kind of diseases, they're all related. They're all inflammatory, and they're all things that we can absolutely treat the root cause of it. And so this doctor out here, who is the medical director at the Cleveland Clinic, very popular medical institute out in Cleveland. And this guy, Dr. Rosian, is a lifestyle medicine doctor, and lifestyle medicine physician is someone who works with you to create a personalized self-care plan that you can implement and sustain. This addresses your lifestyle habits and will be the primary way of treatment and managing your chronic disease, or as I like to say, preventing chronic disease. And so he's come out on record and he said that dentists should be on the front lines for all of this. There's no other provider that you go to on a 3 to 6 month basis that's looking right inside the portal that your body is connected to the external world with. That's your mouth, that's your nose. And so, dentists really need to be on the front lines for, making this whole body connection and being responsible for calling things out when they see things. So, myself and Jen and my whole entire practice development team, we make it our mission to reach out to dentists and do CEs. I was just doing a CE lecture last Thursday with a bunch of dentists, educating them on this stuff, because, dentists are in the best seat in the entire healthcare network to be able to look for things and call things out before they become problems. So it's really cool that these MDs are now recognizing, us dentists as being on the front lines here. So as we like to say, the pillars of health are, sleep and breathing, diet, nutrition, the things you put into your body, and of course the way you move your body. And we feel like if all those things are kind of in line and are right, you're going to have good mental health as well. So tonight we're going to talk a lot about sleep. So what does sleep have to do with health? Well, sleep is extremely important. Sleep is your superpower. And so sleep, there's a number of good books out here. This is one of my favorites. This is by Dr. Walker, Matthew Walker. He's a PhD. And so he has kind of dedicated his entire career to being able to study sleep. And so in the book, he highlights the buzz that scientists have discovered, something that can make you live longer, live healthier, become more creative, and also make you more attractive. This natural resource, he writes, keeps you thin. It reduces your food cravings. It protects you from cancer. It protects you from dementia, colds, and the flu. It lowers your risk of heart disease, stroke, and diabetes. You will feel happier, less depressed, and less anxious. And these are just a few advantages of a complete night's sleep. So if you haven't read this book, I'd highly recommend it. It is good sort of nighttime reading. And I think you'll find that what the scientists are finding is there's really nothing in this world that sleep doesn't influence, whether that be physical health, mental health, and just the way that you perceive yourself and the whole entire world. Sleep is really that superpower that we really need to pay more attention to. And so, people know this, but we spend more than a third of our lives sleeping. And so that means that if we spend more than a third of our lives doing this, why not make it the most productive we possibly can? And so when we sleep, we get a chance to let our brains clean themselves. We get a chance to let our brain recharge itself. We get a chance to let our cells repair themselves. We get the chance to let our bodies restore themselves. We get a chance to let our bodies heal themselves. Our bodies release really important hormones. Our bodies go through these systems of immune system protection, of digestion, of metabolism, of taking short-term memories and creating long-term memories at nighttime, making your thoughts more creative, making you overall a more interesting person, a smarter person. So sleep kind of is what allows us to be able to take all of our day's activities, our day's worth of information, and process it long-term and really get the best out of our life. It allows us to regulate our moods, allows us to, as I said, strengthen up our immune system, which is more important now than I think it ever has been. And so how much sleep do we need? So this varies throughout life. And obviously, as we're precocious, as we're newborns, we need a whole lot of it, because as everybody knows, sleep is where we grow and where we develop. So obviously more time is needed to dedicate to that as we're, in our peak years of growth. One of the myths that's out there is the fact that, some people can get by with 6 hours of sleep, and some people can get by with 5 hours of sleep, or some people need 9 hours of sleep versus 8 hours of sleep, or some people need 10 hours of sleep. And the research is not in favor of that. In fact, the research points to everybody needs about 7 or 8 hours of sleep. And that's kind of, it can vary between 7 or 8 hours, but everybody needs at least 7 hours, up to 8 hours. And so if you're sleeping less than that, that's a big red flag. If you're sleeping more than that, that's another big red flag. And that's something that we'll talk about tonight. If you're sleeping 8 hours and you don't feel rested when you wake up, that's a big, big red flag. That's a big problem. And that probably means that your sleep is not sleep's quality is not as good as it should be. And so a healthy night's sleep consists of about 5 cycles. And so a lot of people, I'm not going to get into the science of this, but a lot of people don't realize that the deepest levels of sleep are where we need to spend the most time. So I have a lot of patients that toss and turn. I have a lot of patients that snore. I have a lot of patients that are having, disturbances throughout their entire night's sleep. And so they never get down to these really deep levels of sleep. So as you can see, in this cycle 1 of sleep, there's a lot of time devoted to what's called stage 3 delta wave sleep. This is physical restoration. As you can see, cycle 2, physical restoration. This is really deep sleep. And then as we see the REM sleep, which is marked here by this red line, the REM sleep gets really ramped up towards the latter parts of the night and towards the end of our night's sleep. So we really do need that full 8 hours, that full 7 or 8 hours of sleep, because if we don't get good sleep when we start off our sleep, we're missing out on that body healing. And if we don't get good sleep in the morning, in those latter stages of sleep, we're really missing out on that brain health part of sleep. So it's really important that we get five cycles out of our night's sleep. And so, what happens if we don't get enough sleep? Well, of course, we open ourselves up to trouble. We open ourselves up to colds. We open ourselves up to digestion problems. We open ourselves up to not being able to focus in school. That's a big sort of point of contention with amongst the pediatric population that we treat. I'm actually having a couple of psychologists tour the office next week who are really interested in learning how sleep affects kids' behavior. And so the research is out on that, and it's pretty strong. So we can't expect our kids to go to school and learn without having that good night's sleep in hand. And we can't expect our kids to take what they learned in school that day and not process that long-term if they're not getting that good sleep. So of course, like as I mentioned, irritability, mood swings, headaches, migraines. We have a ton of patients that come in, with headaches and migraines just because they're not sleeping well. Weight gain, obviously, we can't control our metabolism. We can't regulate those hormones that tell us whether or not we're hungry. We can't regulate those hormones that tell us whether or not we can break down our foods and use them as sources of energy. Poor vision, and of course, for a lot of men, it's that depleted sex drive that sort of drives them. And so we know in other things, sleep deprivation can be very deadly. Skipping one night's sleep already makes you legally incapable of driving. And so I don't know if you guys have ever pulled all-nighters like I used to in dental school, but that's really dangerous. And the research shows us that that's not healthy. And there's a lot of motor vehicle accidents that are caused by this. And so I don't know about you, but I'm close to Interstate I-95. And if I'm, traveling up and down the Interstate I-95, getting to and from work, there's these big, huge, large 18 wheelers that are buzzing by me, I'm hoping that that driver of that large truck is alert and has got a good night's sleep the night before, because there's a lot of fatal crashes that have been, documented and have been attributed to lack of sleep. And in a lot of times, patients that have sleep apnea. And so I think this slide's always pretty cool. Jen loves this slide. And so, we kind of compare the hours of sleep that you got the night before with how drunk you are the next day. And so we know that this to be true is if you're not sleeping, you might as well be walking around with intoxicated in your system. And so if you had 0 hours of sleep, that's like walking around with a 0.19 BAC. Like how productive can we be, walking around drunk all day, walking around this cognitive dysfunctional phase. And so the research is pretty clear on this. A lot of crashes, vehicle accidents can be caused just through lack of sleep, probably more so than actual drunk driving. So why don't we sleep? So there's a number of reasons why we don't sleep. So some of it can be some psychological and emotional issues. We'll get into that. Anxiety, depression, stress, insomnia. There's some physical reasons why we can't sleep as well. Some of the lifestyle choices that we make. Do we have caffeine, after lunch? Do we smoke cigarettes? Are we having alcohol? There's a big sort of misconception with alcohol because everybody thinks you have too much alcohol and you get to sleep easier. And although that to be true, when you actually have alcohol in your system, and too much caffeine in your system, it will affect your level of deep sleep. And so that alcohol is a CNS depressant, and that actually prevents us from getting into deep sleep. So we get a lot of light sleep when our bodies are intoxicated with alcohol. And so our bodies are just trying so hard to work that off, and they can't concentrate on the things that matter, like hormonal control and immune system and regulation of your nervous system. And so there's a lot of breathing issues that can cause you to not be able to sleep. And so we're going to talk about those tonight as well. And I thought this statement was pretty powerful. So it is physically impossible to wake during the night due to a psychological or emotional reason like stress. I talk to a lot of my patients, in my practice, and they kind of unknowingly blame their stress or their emotional reasons for their poor sleep. And although that may be true and that may be keeping them from getting into sleep, once we're asleep, we know that stress actually doesn't wake us up. Once we're asleep, we know that emotional reasons and psychological reasons don't wake us up. And so this is sort of found here in the research. In 2014, the Mayo Clinic did a study where basically what they found, they took a group of about 1,200 people, all who suffered from chronic insomnia. And so these people were referred by their PCPs for insomnia because they claimed that they could not sleep even after the use of over-the-counter medications, prescriptions, and they were failing basically pharmacotherapy. And so the results here are pretty astounding. And so it's really kind of crazy what they found. So out of those patients, they were able to sleep test. They were able to give these patients sleep tests. And what they found was that 91% of them actually had sleep apnea in moderate to severe levels. That's pretty astounding because that's, from my experiences in my practice, I found this to be very true as well. We have a lot of patients that just come in and say they have insomnia, and then we have them sleep tested. And it turns out, the reason they might have insomnia is because they can't breathe at nighttime. And so their brains have learned that it's actually safer for them to be awake than it is for them to sleep. So of course you're going to develop insomnia, if you have a breathing obstruction, if your brain is at all alert and protective of, the things that are happening, that insomnia can be something that is manifested through many years and years of breathing problems. So pretty profound study there. So what is this sleep disorder breathing that we're talking about? Well, there's different levels of it. There's different spectrums. There's different sort of conditions that fall on the spectrum. So we have everything from snoring all the way up to obstructive sleep apnea, with upper airway resistance syndrome being in the middle. And so before we kind of get into what that is, I figured I'd kind of pause here and shed some light on this snoring epidemic that we have going on.
I didn't know I had sleep apnea. My mom told me I had sleep apnea. I was asleep at her house about 6 years ago, sleeping in the guest room, the same way I always do, just like this. And I woke up. My mom's at the foot of the bed like this. Oh my God, Jose. You're dying. Mom, I'm not dying. I'm snoring. Joseph, that is not snoring. You look like it. Joseph, you have to go to a doctor and get that checked out. I'm telling you, you're going to die, and I don't want you to die, Joseph, because I'll die of heart attack if you die. Oh my God, Joseph. Mom, I'm not going to go to a doctor for snoring. How long will you watch me? That's creepy. And I kicked her out. Get out of here. Get out of here, Mom. I'm sorry, Joseph. I did not mean to startle you. It's just that I was walking to the kitchen and I heard a noise coming from the guest room. It sounded like someone was killing a bear. And I was like, I don't have a bear.
So just shed some light on some humor there. But yeah, so like he said, you know, snoring is often the first sign of a sleep disorder breathing problem. And so, you know, it's amazing how many people I still talk to these days who think that snoring is normal. And, you know, I'm here to tell you that snoring is never normal. Snoring is not a normal occurrence at all in your life. And so if that's something that happens, you know, routinely or consistently, then it's probably, you know, it's probably the only risk factor and the only sign you need to try and get that checked out and figure out if there's that scary condition underlying snoring, which is called obstructive sleep apnea. So, you know, regardless of whether or not you have sleep apnea, we now know through research that, you know, snoring causes plaque in our arteries. And so this is documented in the literature. And we know that even in the absence of sleep apnea, in just primary benign snoring, we now have traced patients and we've seen heavy plaque formation form because of snoring in their arteries, which is pretty scary stuff. And that's independent of obstructive sleep apnea. And so, you know, one of the coolest little tools that we use in our practice, and this is what I encourage a lot of dentists to use in their practices, you know, we have these chairside conversations with patients, you know, hey, you know, snoring's not normal. Oh, okay. Well, you know, how do I know if I'm snoring? Because, you know, one of the things that we always say to our patients is, has anyone told you that you snore? So we don't ask a patient if they snore, because if a patient knows that they snore, then they're not sleeping. And so that's probably a pretty big red flag. So if you know you're snoring, it's probably because someone has told you that you snore. So we do these bed partner surveys. And so if we don't have a bed partner to ask, then we have these patients download these apps on their phone. And you can do this through any smartphone. You just, you know, download SnoreLab. You literally record your night's sleep. You can kind of scroll through your night and you can actually hear yourself snoring. And, you know, they give you a scale as if it's, you know, quiet, light, loud, epic snoring. So it's a really good resource and a really good tool, really cheap tool to be able to use to figure out if you do have a snoring problem. So I'd advise everyone who's suspicious of this or who knows somebody who's suspicious of this to download this and start using it. So obstructive sleep apnea is a condition where basically the muscles in the back of the airway become relaxed to the point where they block the amount of the airflow that is coming in through the body. And so obstructive sleep apnea can happen in a number of different spots, mostly through the nose or in the back of the throat where the base of the tongue and the soft palate is at. So how do you know if you have sleep apnea? Well, we have a series of risk factors and screening things and sort of signs and symptoms that you can look for. So number one, obviously loud snoring. If you're snoring, that's your body's alarm saying that something's wrong. Obviously, we have patients who have their spouses witness them stop breathing in the middle of the night. Morning headaches, that is like a dead giveaway. If you're robbing yourself of oxygen at nighttime and you can't breathe properly, you're putting a tremendous amount of stress and you're putting a tremendous amount of strain on your brain, on your heart. And so, you know, when your body is depleted of oxygen, it's normal that you're going to wake up and feel foggy. It's normal that you're going to wake up and have a headache. And so we see a lot of patients with migraines and tension type headaches just because of their sleep apnea. Excessive sleepiness during the day. It's not normal to take a nap. Kids nap. Adults should never nap. Adults should be sleeping at nighttime when they're supposed to sleep. Insomnia. If you think that you have insomnia, that's a big red flag. Difficulty concentrating, lack of short-term memories. Maybe you know what you were doing when you were 30 years old, back in the day when a specific event happened. Maybe you can recall things from, 5, 10, 15, 20 years ago, but maybe you have a hard time recalling what happened last Tuesday. And so those are the short-term problems that we see with patients who have sleep apnea. Waking up frequently to urinate. So that's a big problem that we see in our practice all the time. Oh, I wake up, I only wake up to pee. Well, I'm here to tell you, if you have sleep apnea or if you have a breathing condition, that's going to cause your bladder to fill up at night, because if we're actually sleeping, we have these hormones that are regulated. One's called AMP, one's called ADH. So when we sleep, antidiuretic hormone actually increases, and that actually prevents the bladder from filling up. So there's no reason why you should be waking up to urinate more than once, maybe once at the absolute max. There's no reason to wake up to urinate in the middle of the night if you're getting into that deep sleep like I like my patients to get into. Dry mouth or sore throat after waking up from sleep. This is probably a good sign that you're a mouth breather. This is probably a good sign that you've been sucking air through your mouth during the night. And so I like to call these signs and symptoms the old fat man signs and symptoms. So all jokes aside, the old people, the fat people, and the males are the easiest ones to spot because they kind of fit the mold. And so you see an old fat guy walking down the street, you probably assume, with a big turkey neck, you probably assume that he has sleep apnea. And that's sort of the easy way. And that's what our physicians are looking for these days. Our physicians are getting better at screening for old fat men. But what I'm here to tell you is there's a lot more people than old fat men that need help. There are people like this that need help. This is what's called upper airway resistance syndrome. Upper airway resistance syndrome is a precursor to sleep apnea. These are the people that have the exact same problems going on, but they don't hold their breath long enough. They don't suffocate long enough to show up on a sleep test. So a lot of these symptoms can be people that have problems falling asleep, problems that have daytime sleepiness, problems regulating their moods. I see a lot of young, fit females inside my practice that have anxiety and depression, that have mental stress. They're in that constant state of fight or flight. So this upper airway resistance is actually characterized by sleep fragmentation, which is just as destructive as sleep fragmentation because of obstructive sleep apnea. And this is due to microarousals during sleep in association with upregulation of the sympathetic autonomic nervous system, which basically has to kick on every time you have a resistance to airflow through your nose during sleep. And so I like to call this the young, fit female. So I see both of these in my practice, and I've sort of made it my mission to educate people that there's a lot of young, fit females walking around here that need help with their sleep. And so we treat a lot of these people at my practice. So what other signs can you look for? Well, you need to go to your dentist. You need to have routine checkups, and you need to have your dentist start screening for this stuff. Your dentist should be looking at your teeth and your tongue. There's many, many, many more things that educated dentists know how to look for. But these are two things that you can look in the mirror right now. Are your teeth starting to wear down? Are you bruxing your teeth? Are you grinding your teeth? Are you clenching your teeth? Are your teeth starting to become shorter? Are you starting to wear them down? Has your dentist mentioned that you might need a night guard? Well, I don't agree with night guards, but if your dentist mentions you might need a night guard, it's probably because of your grinding. And so you want to look into that. Are you grinding your teeth during the day? If so, stop it. If you're grinding your teeth at night, I know you can't stop it. You're just trying to breathe. And we'll go into that in just a second. The tongue is another very, very, very important airway muscle to look at. There's a lot of problems today with people who have small jaws, tongues that don't fit in the mouth correctly, and tongues that drop to the back of the airway and cut off the breathing at nighttime. So this study came out in 2008. And we now have learned that nocturnal bruxism, which is clenching and grinding, is actually a protective mechanism against obstructive sleep apnea. And the results are staggering. We find that 79% of people that grind their teeth during their night's sleep have sleep apnea. And that's predictive of a sleep breathing disorder. So we now know that if a person's brain has to make that conscious decision when the airway becomes blocked, the chin falls back, the tongue falls back, the brain has two decisions to make. One, it can either wake you up out of your sleep. Now that would be very, very disruptive and would start your whole sleep cycle over again. The other thing it can do is start grinding your teeth. Every time your teeth are clenched together, your airway then opens up. You clench your teeth, your airway opens up. And so we see these patients that are going through these vicious cycles of not breathing and then grinding and clenching their teeth to be able to open up their airways. And so that's grinding and clenching is very predictive of a sleep apnea problem. As I mentioned, tongue scalloping. If you look here on this tongue here, you can see this scalloping. See these little ridges? Everybody can check their tongues tonight when they go to sleep. If you have a nice midline groove in your tongue, if you have these ridges in the side of your tongue here, you probably have a small jaw structure. You're probably likely thrusting that tongue forward at nighttime in order to accommodate for a breathing problem. Tongue scalloping has been found to be 70% predictive of OSA, of obstructive sleep apnea. So if we have grinding of the teeth and we have scalloping of the tongue, that's a great reason to get help. Okay, so this condition that we talk about of obstructive sleep apnea, how many people have this? Well, you probably wouldn't guess this, but it's a lot more common than you think. Over 40% of adults over 40 snore. That's approximately 87 million Americans. 26% of our population suffer from some form of obstructive sleep apnea. That's a quarter of our population. 1 out of 4 people have obstructive sleep apnea. Less than 10% of those obstructive sleep apnea patients have actually been diagnosed. Of those, less than 25% have actually been treated. Let's get into that. So what are we talking about here when we talk about obstructive sleep apnea? We're talking about a problem that costs our healthcare system quite a lot of money. So we know that sleep apnea patients use healthcare resources at approximately twice the rate of people who do not have this problem. We know that hospitalization stays are almost 3 times higher for patients with obstructive sleep apnea. So our healthcare dollars are being spent on these patients who have obstructive sleep apnea, most of them not being treated properly. And so we have a system failure. We have this system that's in place right now where, our physicians are struggling to recognize these patients. Our dentists are struggling to recognize these patients, and our patients are struggling to recognize their own problems. And they're just treating themselves with Band-Aid, medications and things like that. And so when we talk about sleep apnea, we have a $1 billion industry, what's called the CPAP industry. And for all of you who do not know what a CPAP is that machine that sits on your face and blows oxygen through your airway all night long. And so billions of dollars are spent on this every single year, over 5 billion. A majority of the time, these CPAPs fail. Patients fail CPAPs. The numbers are proven. The research is out there. Over 50% of people that try CPAP fail CPAP. So we're spending $5 billion a year, and our success rate is 2 to 3%. So something's wrong. Something's going on. So what is this? This sleep apnea epidemic is here. Only 2 out of 3 of the 100 people who have OSA have been successfully treated. The lack of diagnosis of sleep apnea is unprecedented for a disorder that's this deadly. So do you think there's a market for more people to get involved? Do you think there's a market for people like me to start doing more airway evaluations and finding alternatives to CPAP? I mean, you better believe it. So what's wrong with our current model? In this study, we found that there was 101 primary care physicians who were studied. 35% of them were flagged as high risk for having obstructive sleep apnea. That's fantastic. We have questionnaires that are being filled out that flag people for being high risk. What percentage of those patients were actually referred for a sleep study? 2%. 2% of the 35% of the patients who were flagged as being high risk for obstructive sleep apnea were sent for a sleep study. So now we can't even get a diagnosis. So over 3 times as many of those patients that were flagged as high risk for having obstructive sleep apnea were actually sent to a psychiatrist to be put on meds or to see what was wrong with their heads. Something's wrong here. This model that we have in our current healthcare system doesn't work. So we know that sleep apnea is common, it's dangerous, it's costly, but we also know that it's treatable. So when we talk about how to treat this, there's a number of different things we can do. So obviously the gold standard, as most people have come to kind of fear, is this big, huge mask on someone's face. And CPAPs are great. CPAP works really well. It is the gold standard for treatment. If you can tolerate a CPAP on your face, I have no problem. If that's going to prevent you from choking at nighttime, I have no problem with that. If that's going to prevent you from starving your body of oxygen, I have no problem with that. But there's a lot of alternatives that we have nowadays. I make these things in my clinic. This is very routine for me. I make appliances all day long for patients who suffer with airway concerns. We now have gotten so into this alternative to CPAP that we now know how to treat with other modalities. We know how to do jaw surgery. We know how to do what's called myofunctional therapy. We now know that the orthodontists have a big, huge role in expansion. And I can speak sort of candidly on this because my wife went through this. My wife had to get an expander put in to widen her airways so that she could breathe better. And so we have so many solutions nowadays. But the first step is we got to find somebody who can do a comprehensive evaluation. So when we talk about solutions, we have to find a qualified provider. We have to go to somebody who knows what they're talking about. We have to go to somebody who's not just going to do a test and stick a machine on your face. We have to go to somebody who understands the options that are out there. We have to get a comprehensive airway evaluation done. If you don't know what's going on, you can't treat it. We have to let research, science, and proven success determine how we are able to decide on what treatment is right. So research, education, this is stuff that's going on in my clinic every single day. We're kind of continuing to challenge the norms. We're continuing to challenge what we previously knew, where there's multiple practices, private practices, educational institutes around the world that are coming out with new protocols every single day. And these are good options. And so I joke when I say, how big is your airway? But I don't joke because it's something we say all the time at our practice. How big is your airway? So we have a machine inside of our practice called a cone beam scan. And what it allows us to do is it allows us to take three-dimensional images of our patients' airways. So we're looking at patients' noses. We're looking at the back of their throats. We're looking at the parts of the airway that can become affected because we want to know where the problems are. If we don't know where the problems are, we don't really know how to treat. And so actually I have a quick funny story with this. We had one of my front desk, her husband came in last week. And so he doesn't really know too much about this stuff. And she's sort of a newer employee. And so he had a scan done and my wife or my front desk receptionist said to her husband, here's why you snore. You know how I keep elbowing you at nighttime? And he goes, oh boy, what are these dentists selling now? And she goes, they're selling quality of life is what they're selling. And so I got a good chuckle out of that. And he goes, oh yeah. He goes, how much does that cost? And she goes, well, it's going to cost you a lot less. Than your divorce is going to cost. So I found that pretty funny. So a lot of good books on this. A lot more attention is being given to this type of stuff nowadays. Breathe is a new book that I highly recommend anybody who is interested in sleep, anybody who's interested in the science of breathing, anybody who's interested in the role of a multidisciplinary team of providers who can affect, the way you sleep, your health and stuff. This is a great book. This is a guy named James Nestor, who's a journalist. And this book is just fantastic. I highly, highly recommend it. Another book I highly recommend is called The Oxygen Advantage. And this is by Patrick McCown. He's a guy who I studied with and who has trained my myofunctional therapist in my office. Great book. So I highly recommend those. And so I figured I'd end on a couple of little success stories here. So here's a patient who was just in last week, and she felt so compelled after a month of treatment that I asked her if she'd be willing to just get a camera on and kind of go over her experience.
Tell us what brought you into the office.
Well, I was struggling with sleep. I was awake 5 and 6 times at night, having night sweats, waking up really tired, groggy, wanting to sleep during the day, and not really feeling good, And a friend of mine had said, well, there's this doctor who deals with sleep. Now, I've been diagnosed with sleep apnea, but that was 10 years ago, and my oral apparatus was really sort of not fitting well, and obviously not helping me because I was awake all night long. Going to the bathroom 5 and 6 times, and it was just getting to be a problem because sleep is so important to our health and well-being. And I understood that, but I didn't have that. And so I came to the Sleep and Pain Center to get some assistance. And I was fitted with a daytime appliance because there was an issue with my bike, and the cartilage in my jaw. And I was also fitted for a nighttime sleep appliance. Now, it's been a little bit over a month, and there have been some changes, some of them very subtle and some of them not. But the thing is that I'm sleeping better. Like just this last night, I put my sleep appliance in, and it was about 10:30. And I can remember sort of falling off to sleep. And I woke up at 7:30. I didn't go to the bathroom. I didn't turn over. I didn't remember the covers not being where they needed to be. I didn't remember adjusting my knee pillow, nothing. Wow. And I had dreams, two of which I remember. I woke up, I was absolutely thrilled. And the thing is that when I wake up now, I am not tired, I'm not groggy, I'm not wanting to turn over and go back to sleep. And all of this is because of the work with Dr. Robinson and office staff, which are really very supportive. And because I can call sometimes, I remember when I was having a problem with the daytime apparatus and the bite, they said, come in. I came in, the adjustment was made. Now I don't have bite issues with.
So she can kind of go on for a little bit, but these are the cases that I just so enjoy talking to these patients. And as rewarding as it was to be a dentist, like Jen mentioned, I was really motivated to give people their perfect smile. Being able to help somebody sleep is just the ultimate reward for me, and being able to get someone out of pain is the ultimate reward. And so I'm gonna have Lauren tell you her story, and then we'll wrap up.
Hi everyone, my name is Lauren, and I'm a patient of Dr. Robinson and have gone to the Pain and Sleep Therapy Center. I have been seeing Dr. Robinson as my dentist for my whole life. Recently, this past year, Dr. Robinson and I were discussing my TMJ issues a little bit more. I have pretty severe clicking on both sides of my jaw, and it's not too painful, but it's definitely something that concerns me and something that we've always kind of had our eye on, but that we really wanted to start investigating more, this previous year. So Dr. Robinson was going to fit me for an oral appliance, and he thought it would be a good idea if I also took an at-home sleep test to see if there was maybe any other issues going on besides my TMJ. And I kind of, was hesitant at first, like there's no way that anything else is going on, sleep apnea, anything like that. So I took the at-home sleep test. It was super easy. It's super simple to do, just like any normal night's sleep. The machine is super easy to use. It doesn't really disrupt you during your sleep, which is really nice. So I took the test, then we got the results, and to all of our surprise, we found out I did have very slight sleep apnea. So in addition to my TMJ issues and the sleep apnea, we decided to build me this oral appliance that would help correct both of these issues. So my appliance sets my jaw forward a little bit at night to open that airway to help with my sleep apnea. And it also takes pressure off of my jaw so that I'm not waking up each morning, in a lot of pain from punching down, or feel that additional pain just from sleeping or clenching. So I'm super happy that I went to Dr. Robinson, told him about my issues. Although it didn't seem severe at first, we learned that it was a little bit more severe than we thought it was. I also think that you don't really know maybe what a bad night's sleep is like until you've had a really good night's sleep. I thought I was, healthy, sleeping fine, sleeping throughout the night. But now with my oral appliance, I really feel like I'm getting a lot more quality of a night's sleep too. I feel a lot more rested and happier throughout the day, probably because I'm feeling more rested. So I'm super thankful to Dr. Robinson and his team for helping me out. They're all super friendly. I loved going to the office and talking to everybody. I really felt like everyone truly cared about me, what I was feeling, what symptoms I was going through, and all of that as well. So I'm only 25. I'm really super happy that I took control of this problem early. and that things are not going to get, worse for me or deteriorate over time, that I'm really taking control of my health and doing what's best for me. So thank you so much, Dr. Robinson and his team. You guys are so awesome, and I appreciate you a lot. Thanks a lot.
So that was Lauren, and I thought that was really profound what she said. I mean, we get this all the time with our patients. It's like, I really didn't know what a good night's sleep was until I got a good night's sleep. And so you only know what you know, and so you don't know what you don't know. And I love that those sayings, because it's so true, and it rings so profound in our practice that, some of these patients come in and they think they might have a mild problem, or they don't really think that too much is going on. And then you show them what a good night's sleep is like, and you show them what life is like after a good night's sleep, and you show them what life is like when they're not dealing with jaw pain, and they're just super thankful, and it's a whole new life for them. So Lauren was a fun case to treat, as all my patients are. This patient just came in a couple days ago, and she got the new Inspire device, which is a little implant that goes inside the chest. Here. You get a little incision right here where there's a tongue stimulator. So she wrote me a really nice email, because I was the one that kind of encouraged her to move forward with all this stuff. And so sometimes I help these patients, and sometimes I'm just kind of the coach from the sideline, and I kind of I put them in the hands of the other person who can treat them. So I like being that point person. I like doing my airway evaluations, and I like getting the patients over to, get the treatment that they need. So she wrote me this really nice email, which I won't go into. I won't read it for the sake of time, but she just was saying how thankful she was that her dentist of all people, was the one who got her sleep apnea fixed. Her PCP, her gastro, her ENT, none of these doctors, had any solutions for her issues. And, she was very thankful to me. And it's just like patients like that you just, you put your head on the pillow at nighttime, and you just feel really good about. And then just a quick call to action to the pediatric part of our practice. So we want to make sure we get to this stuff before there's problems. And so, as you can see here, this little girl trying to sleep with her mouth open, this little baby trying to sleep with the mouth open. So that's one of the calls to action that I have for everybody out there, is making sure nobody that make sure no kids, make sure no adults, make sure nobody is sleeping with their lips open, because that is just opening your body up for inflammation. We need to breathe through our noses. And so, we start therapy as soon as we see symptoms. And so that's a sign right there. That's a symptom. So we need to treat that. And so I've kind of made my career so far, and I've done really well for myself. And I'm very proud of all the patients I've been able to treat. And I'm good at these people. I'm good at these people, good at these people. I'm really good at putting out fires, but our practice has developed incredibly over the last year to 2 years. And we're now treating these people. We're treating these people, and we're treating these people. So I'm very proud to announce that our office has kind of come full circle, and we are catching the smoke long before there's ever a fire. And that to me means more than anything. And my kids are the same. I could go on and on about my kids. I won't, but that's something that really kind of drives me. So another call to action for you, track your sleep. Go out there, download the Snore Lab, get a Ring, get a Fitbit, get an Apple Watch, start looking after your sleep. These things can't tell you whether or not you have sleep apnea. These things can't tell you whether or not you have good sleep, but they're good at looking at trends. And if you find that you're moving around a lot at nighttime, if you find that there's any noise at nighttime, if you find out that there's any problems that come about when you track your sleep like this, you need to go see an expert. You need to get this stuff treated. So I just want to say thank you for your time and attention tonight. I'd love to take any questions that you guys may have. And again, here's our social media. Follow us. I think you'll find that not only is it educational information, but it's very engaging, and we have a lot of fun too. So thank you so much for everybody who joined tonight. Jen, is there any questions that I need to take?
We just had one question. Someone wanted to know if this would be recorded for her husband to watch it later. We do have a new Zoom recorder. So as long as everything went well, we hope to go ahead and share this on our Facebook page tomorrow, and also upload it onto YouTube.
Excellent. Yep. Awesome. Anybody else out there that has any questions for me?
Feel free to email Dr. Robinson or myself as well. I'll put it in the chat window. If you have any questions you're just not comfortable asking live this evening, we'd be happy to answer later on for you as well. And then also certainly you can call the office or also make an appointment through our website. There's a consultation. You come in, we'll spend about 2 to 3 hours with you. I know that's kind of crazy compared to some other medical offices that are out there, but we really want to get to the root cause, and we're going to have you in and, you know, do a scan of your airway, your nasal passage, your jaw joints, and really get to the root cause of what's going on for you. So I would encourage everyone, if you're kind of thinking, oh, this might be me, this might be my husband, come on in for a consult.
Awesome. Thank you so much, Jen. And thank you so much, guys. We'll be in touch about, the next one that we do. So have a good night, guys. Take care.
Thanks for joining us. Bye-bye.